All right, good evening, everyone. Thank you so much for tuning in on this installment of Sowing Seeds. My name is Nathaniel. I'm a fourth year medical student. Today, our topic of discussion is going to be being a minority male in medicine. So we have the privilege of having three panelists joining us today. So first, we have Dr. Love Anani. He's a full-time emergency medicine physician in the North Crest Emergency Department in Nashville, Tennessee, where he serves as the medical director, chief of staff, and Robertson County EMS director. He attended medical school at Howard University College of Medicine, where he earned his MD. And for residency, Dr. Anani attended Central Michigan Emergency Medicine Program, where he was co-chief resident. And Dr. Anani currently lives in Nashville, Tennessee, but he's a native of Houston, Texas, where his family continues to reside. He enjoys sports, comics, and is an avid gamer. And he's currently married to Dr. Uchenna Anani, who is currently a NICU attending at Vanderbilt University. And they have twin boys who are rambunctious and spirited. So next we have Dr. Anthony Douglas II. He is a general surgery resident at the University of Chicago, a public health expert and dedicated advocate for health equity. He created the nation's first surgical advocacy fellowship, a curriculum designed to equip surgeons early in their careers to serve as change agents in addressing health disparities. He has led state and national advocacy efforts to lower prescription drug costs, including testifying before the U.S. Senate Judiciary Committee. And Dr. Douglas' leadership has been recognized through numerous honors, including the Emerging Public Health Leader Award from the Health and Medicine Policy Research Group, induction to Phi Beta Kappa and Alpha Omega Alpha Honor Societies, and membership in the prestigious Omega Psi Phi fraternity. And a published author and frequent speaker, he brings a unique perspective at the intersection of medicine, policy, and social justice. And last but certainly not least, we have Dr. Marius Chukwuera. He is a sports and preventive cardiologist specializing in cardiometabolic health optimization. He completed his medical degree at Howard University College of Medicine, internal medicine residency at Duke University, and cardiology fellowship at the University of Pennsylvania. He went on to pursue advanced fellowship training in sports and exercise cardiology through the Cardiovascular Performance Program at Massachusetts General Hospital and Harvard Medical School. He previously served as an active member and leader within SNMA as a Region 6 director from 2016 to 2018, where he championed mentorship, diversity, and health equity in medicine. And he currently practices in Washington, D.C. in a comprehensive sports and performance cardiology program. So first, I would like to thank the three of you gentlemen for joining us today to share all of your insights and wisdom with our audience. First, just to open it up, I want to ask if each of you can briefly share your journey into medicine and how your upbringing or early environment shaped the way you approach this journey. And it can be whoever wants to go first.
I can go first. So my name is Anthony Douglas. Thanks for the introduction, Nathaniel. From South Bend, Indiana, originally. Went to undergrad at Wabash College and did medical school at Indiana University School of Medicine, and now doing my surgical residency at the University of Chicago. My journey to medicine started probably around third or fourth grade. Knew that I wanted to be in a field that was dedicated to service. Also had an early passion for human science and understanding how the human body worked. My parents pushed me towards medicine. They always, I remember as a kid always hearing, from my parents that they wanted me to go into a field where it didn't matter what you look like. If you were green, yellow, red, black, or white, that you would always have a job. And nobody would care what you look like as long as you could help them. In addition to that, you would always have a job no matter what is happening in the world. And I think the pandemic was a great example, proving them to be prophets. But went to a high school that had a magnet program for students interested in medicine. You got to take your core high school classes, and then got to do like medical terminology, some shadowing, and met a black doctor by the name of Dr. Carlton Lyons, who was an OBGYN, and just really inspired me and was the first person I could touch at the age where I was still dreaming and aspiring to be a physician that looked like me, and that it just inspired me day in, day out, and actually kept me on the path to medicine when I was struggling in undergrad and not performing as well as I wanted to in the pre-med courses. So went to college, of course, struggled, but in undergrad faced challenges that we all have faced in terms of being one of few students in the classroom in those intro courses that had a passion for medicine. But through the grace of God and the help of mentors, overcame those obstacles and went to medical school. So that's briefly, just in a nutshell, where my passion and how I've gotten into the field of medicine.
All right, I'll go next. So similar story, actually, very similar theme. Um, people pouring into me, pushing me to do it from a very young age. My parents, uh, being Nigerian, probably heard this before, but they're like, if you're not pursuing law, medicine, or engineering, you're a failure in life. Like you ain't nothing. So for me, it was medicine. My mom and dad really pushed me, um, very early on. Also went to a high school with a magnet program where it was actually an allied health program. So it was meant to give you early introduction to, nursing, paraprofessional type of occupations, physical therapy, you name it. But with that program, I got a lot of early exposure to anatomy and physiology, medical terminology. I took Latin for 4 years, which a lot of the word roots in medicine are based on Latin word roots. So it kind of gave us a lot of early exposure. Went to college, University of Maryland, Baltimore County, majored in biological sciences. I was a very traditional student, like just straight and narrow, pre med major, did the college thing. But, believe it or not, I had no real guidance in terms of how to kind of make med school happen and medicine happen. My parents weren't doctors. Um, so they were just like, do this, figure it out, but this is what you got to do. And eventually I developed my own self intrinsic motivation to pursue it. But that didn't really happen until med school. And I ended up following peers who were also pre med, but had a little bit more guidance. Um, Ended up taking the MCAT, going to Howard University College of Medicine, which I know Dr. Anani went to too. And that was, probably the best 4 years of my educational experience. It was really insightful and taught me what it meant to be compassionate, a physician. That's really where a lot of my style practices come from, just the mentors I had there. And then pursuing cardiology, that was more so I fell in love with the subject matter in the preclinical years, but I still kept my options open. And I really tried to not just put myself in one bucket, but rule out other things and give everything a chance. So I never forget I was in the OR for a 10-hour case, colorectal surgery. I was like, I can't do this. My back, my knees, not built for this. Surgery was quickly ruled out. Then I went through everything else and I realized, medicine in general was my idea of what, a doctor's doctor was when I went to my own PCP and saw doctor in clinics. So I knew I wanted to do internal medicine at least, but I still had the interest in cardiology, and that's where I could pursue it. So I ended up going to residency, fell in love with it again, applied for cardiology, did cardiology fellowship, and then the sports cardiology thing kind of came out of the blue within the last 2 years, just through mentorship and ongoing guidance. But throughout the journey, a lot of people just, telling me you can do it, telling me you should do this, and really just kind of speaking life into me before I saw it in myself. That was a lot of what pushed me along the way. And, just started my practice as an attending here 3 months in, and, it's going pretty well. I think I had a lot of good foundational work to set the playing field for this. So that's my journey in a nutshell.
Those are some excellent journeys. First off, sorry about the lighting. I just got off work, and for all the people who are out there that may be about to go into interview season, and you're like, I don't need no ring light. My setup is fine where I am. Look at me. Get you a ring light. All right. Outside of that, my journey is very similar to Marius's. I'm from a single family home, just my mother, myself, and then my sister came along later. But also being a single family Nigerian home, it was still, you're gonna be a doctor. She was a nurse, and she kind of said it over and over again. And I joke with people that I kind of like realized, maybe like Pavlov's dog growing up, that if you put an adult that you want to be a doctor, you got a pat on the head and like good job and you're smart, whatever, whatever. So I kept saying it, but like everyone's kind of said here, I had no clue what went into that. I kept saying it, got to college, and I was like, dang, I should probably start looking into applying to be this doctor thing. So then I obviously took the MCAT at that standpoint. I didn't know you had to have good grades to be a doctor. So I did keep that up along the way, but I also knew you needed good grades to do just about anything. So I don't think that was the rate limiting step or the main reason. I did do summer programs. I did one in high school called the Carleton Liberal Arts Experience, which kind of just took me to the undergrad I went to, showed me what liberal arts college could do for me. I went there. I did it. I did another summer program while in college back in the day, SMDEP, which used to be SMEP, which was MMEP, all the acronyms. I think it was SPEP last, but it was a summer program, which I think might be out now and no longer happening, which is sad. But it exposed me, and I was like, okay, I really, really want to do this. I did other things with other people, and then my desire to go into emergency medicine after I got a good MCAT score and got into Howard, which is the best medical school. No shade to anybody else. I got my diploma up in here. It's not hung, but it's here. I thought an emergency medicine doc was the doctor everyone saw, right? Like we watch TV, that's what was there. They're always kind of sitting there waiting for you. And I realized early on it was the only doctor that did not ask for your copay before you could see them. And I was like, that's the doc I want to be for my community. So I went through med school saying I want to do emergency medicine, and that part was on the jumble, but I made it here. I'm on shift. I'm one of the few ER docs that still wear white coats. And I really enjoy the decision I made with my life.
Yeah, thank you all for sharing your wonderful introductions and journeys into medicine, your respective journeys into medicine. Um, so I know you guys touched upon it a little bit, but I wanted to dive deeper with my following question, which is how has being a black male in the medical space shaped your experience in medical training or practice?
I can start that one. We can do reverse order. I think a lot of times people hear this question and assume you're going to pop out with the, oh, I got called a slur or did this or did that. And that really hasn't been my journey, probably really thanks to Howard as the setup. The one thing I think it has affected me in every space that I was in post Howard was I always knew that I had to be on my P's and Q's at all times. One step up was messing it up for the next guy. One step up was messing it up for my race. And I wanted to initially believe this was a self pressure, but talking to colleagues and other people, I don't believe so. And I know talking to some of my colleagues who I love, it's not a pressure they feel. I don't think, the few white guys I work with think they come in and represent their whole race. Maybe there's specialties from time to time, but that was about it. But I really felt in every step of the journey, if I tripped or messed up, I was ruining it for the person behind me. You gotta, whatever residency program you go to, you gotta kill it so they get the next Howard person because you were the first Howard person they ever got. Then you finish residency. All right, now I'm working somewhere. I gotta kill it so the next doc can get here, and just so on and so forth. And I feel like it's an extra stress or tax that we have to pay in these specialties, at least for me, and these, just being a doctor in general.
Yeah, piggyback on that. I mean, you used the word tax and you beat me too. I was going to talk about the black tax. It comes with being a black male in medicine, minority in general, but like you have this weight on your shoulders where you feel like you represent everybody that looks like you, everybody that came from where you came from, and you got to go and be the best and excel. Otherwise, the door will close for the people that come after you. But I feel like, in a way, your mindset can shift where you really strive for more so progress than perfection. When you kind of, are a little less hard on yourself to be perfect every day, but you just show up as your best self and try to apply what you got the previous day from feedback. And that comes with being open to feedback. For some reason, And I'll talk about my own personal experience now. Maybe this is unique to me, but I might have an RBF, to not use vulgarity here, but a resting face that doesn't look too friendly. So I try to smile a lot to make sure my peers feel welcomed and whatnot, because I'm a 6 foot plus Black man, and that's not common in these halls, these four-way halls of the walls of the hospital, right? So when people see me, they automatically assume I may come from a certain place, or I may not like the things they like, and mind you, this was never been explicitly said to me. I don't think anybody has the gall at times to even speak on it, but there's subtleties in which you'll hear remarks, little microaggressions, and I've heard them at every stage of training, where I really recognize that I am the other, and may not be seen as cut from the same cloth as the majority of people who I'm training with or who are training me. But the goal is always to be clinically excellent. One thing that one of my good brothers and mentor told me is that if you show up every day, again, giving your best shot, you're not expected to be perfect, but if you give it your best shot and you show engagement and you strive for clinical excellence, all the other stuff that they may think about you, any preconceived notions, they kind of just go out the window, because, and even if they still are present in their mind, they say, but he's doing his job. He's showing up, and, even surpassing your peers. You never want to compare, right? Comparison steals joy, but you want to run your own race and show up better than your best self that was present yesterday. That's always the goal. So I think that's something that I've carried with me. I've experienced it firsthand, and even into attendinghood, I come in. It's a lingering thought. It doesn't leave, but when you know how to manage it and step your best foot forward every day when you show up, you really mitigate all the negative thoughts and feelings that you may have about your experience. Ultimately, it's just about doing the best work and putting the patient first anyway, right? After you're done your training, there's nobody looking after or over your shoulder looking at your work. So it all falls on you. You want to make sure now you're showing up to prove yourself, not only to yourself, which is what matters the most, look in the mirror, but also to your patients. You want to make sure they trust you when they don't look like you. Because again, the preconceived notions come from everywhere. But when you're alone and it's your patient, you and them one-on-one, you want to make sure you build that rapport and that trust. And that, comes through your empathy, the way you approach your patient care, and your clinical acumen.
Yeah, man, I can't. Both these brothers hit on the. Hit it on the head. I don't really have much else to add in terms of the minority tax and the added pressure that comes with being a Black male in medicine. To the last point that was made, we in the Society of Black Academic Surgeons, we have a saying that excellence transcends artificial barriers created by men, right? And so striving for excellence always is the mantra of not only the organization, but should be the mantra for all of us, regardless of your specialty. And that's how you deal with the microaggressions, and you deal with the that tax is just continue to strive for excellence. I'll take on the positive side of being a Black male in medicine. I work on the south side of Chicago at the University of Chicago, and to me, I'm excited. And obviously, residency is hard, and being a physician is not always easy. But I wake up excited every day to go and serve people that look like me. It's a privilege to not only take care of people in their most vulnerable moments, but also to do it for people who come from where you come from or look like you. And so that's just it just gives you a different sense of purpose and a different a passion and drive to continue to do the work that we do when you're doing good for the people who come from the communities that you come from. One of the other things, as a Black man and a male in medicine, and I'm sure some of the medical students on this call can resonate with this, but one of the most refueling things is to just walk through the hospital and hear somebody tell you that they're proud of you, or that they feel more comfortable that you're here. They feel more comfortable about going through a surgery because you are the one that'll be taking care of them. They call you king when you walk around the hospital, all sorts of things, right? And so those are just things that just, as a Black male in medicine in practice, that just give us a different sense of just a different sense of calling and a different sense of passion for the work that we do that I feel like others don't. And then also, you know, as a Black male in medicine, right, we are like 2% or some of certain doctors, right? And so there's a little bit of like, you know, confidence that comes with it, right? We, unfortunately, that's the reality, and we have to address that. But also, it's a reason to pat yourself on the back, right, and say, you know, you've overcome, you know, many of the barriers and obstacles that were set in front of us in order to get into the spaces that we're in. And so, you know, just always, as you strive for excellence, just remember what it took to get here, and remember that you should be proud to be a Black male, a Black face in a field that we have been for a long time excluded from.
Yeah, thank you all for sharing your insight and experiences for that one, for that question. That was a very, I definitely appreciate the vulnerability there. So my next question is, I guess we also like alluded to this a little bit too. How have you learned to balance being confident in your abilities with staying humble in environments where your competence might be questioned?
I mean, I could say for in general, surgery is a humbling specialty. So it's not hard to remain humble. And medicine is a humbling specialty as well, right? In general. So I think that it's not, you know, for me, it isn't too challenging, because the moment you get, you know, overconfident is the moment that, you know, you get your chin checked, and you get reminded that, uh, you know, that you, at the end of the day, you don't know everything, right? And there's always something that'll surprise you. And the man who knows he knows nothing knows everything, right? And so you know, I think that this field of medicine has a way of teaching humility. But I would say um, you know, I think that some of that comes with upbringing, right? And just remembering like where you come from, and just remembering once you make it that, you know, you have a responsibility to help those behind you, but also to make sure that you remain relatable to the people who are inspired by you, right? Sometimes we get into these positions and um, we forget, you know, what it took to get here. So I think it's just important to always remind yourself that, you know, you know, when you make it, to always reach back and to be relatable to the people who aspire to be like you. Yeah, that's my thought.
I'll piggyback off Dr. Douglas's point. You know, I feel like as Black men, minority men, we're oftentimes you know, raised up to be hard, right? Like it's like showing vulnerability is a sign of weakness. You gotta, you know, basically be stoic, repress your emotion, just show up, do the job, keep your mouth shut. That's oftentimes a narrative that's kind of imparted upon us, starting from the household, like when you're growing up at home, and then you kind of carry that mindset forward. But to be honest, one of the most valuable skills that you can learn throughout your journey is knowing when to ask for help, right? Understanding that vulnerability is not necessarily a sign of weakness. Sometimes you need to be open and communicate when, you know, things just are out of your scope, out of your knowledge. Because at the end of the day, like, this is a human enterprise. You're dealing with human lives here. It's not like you mess up, okay, you know, big deal. Like every clinical decision you make with your patients can quite literally sometimes be life or death. I mean, you're dealing with lives in your hands, so you have to be sure to put your pride to the side, right, and understand that while you strive to be clinically excellent, you want to kind of portray that you want people to trust you and trust your judgment. There's a fine line between, you know, being confident and then being cocky, losing your humility and putting, you know, people's lives in danger, putting people at risk from you stepping out of the bounds and the confines of what you're comfortable with. So one of the greatest things you can move forward with, and this is really anybody, it's not just unique to minority men, But in general, you need to know when to ask for help. You know, you got to know how to triage appropriately. Know when you're overloaded with, even if it's just carrying too many patients, just ask for help. At the end of the day, like, you're not the first person to do this. You certainly won't be the last, and people have asked for help before you. And somebody might actually, commend you for knowing that something was just beyond your capability of dealing with.
I think the only thing I'm confident is I have access to all the tools I need to perform my job to the standard of care. That's the only thing I feel like I'm confident in. It's been said here, and it's 1,000% true. Medicine will humble you. There's a saying I've heard before, and I use it like everywhere, especially for emergency medicine. It's walking around in a minefield wearing clown shoes. Like, you swear you're safe, you think you're in a safe spot, but something right in front of you that you had no way of knowing will trip you up. I mean, everything from I literally just left this surgeon's office 20 minutes ago. Oh, look, you have a massive PE and this close to death. Like, it makes no sense. But you will just get humbled. And, I've seen people walk in here and not walk out. It is saddening. I think one of the reasons I stay kind of focused and humble in the way I am isn't just that, but it's kind of been hinted at here, and I'll just say it directly. If you stay humble, no one tries to humble you, right? So I'm not saying stay, quiet and Yiddish in the kind of corner and like, I don't know what I'm doing, but there's no reason to walk around saying, I'm the best doctor in the world, et cetera, et cetera, et cetera. It has never helped anybody. It's never saved anyone's life. And then when something goes wrong, everyone's like, I thought you were the best doctor in the world. You handle it by yourself. So if you just stay humble, helpful, ask for help when you need it, it will take you a long, long, long way.
So to build off of that point, regarding like when to ask for help, I want to ask the next question being regarding mentorship. So I want to ask, did you have mentors who looked like you? If yes, how did that impact you? And if not, how did you find the support?
So people always say you have mentors at like multiple levels, right? So, when I was growing up, the family doctor we went to happened to actually be Nigerian in Houston. So that was kind of like my mentor there. Do I keep in touch with them? I won't lie. No. Just kind of lost touch, but that's what I use to get the knowledge to where I need to get to like undergrad and undergrad mentors. But I always say number one, since med school till now, and probably for the rest of my life, number one mentor is Dr. Alden Landry. He's up at Harvard Emergency Medicine, been doing this, call him the OG. Met at SNMA on the board together, and I tell everyone and anyone I am in emergency medicine because of him. One, we had a connection, just talking with each other, being relaxed with each other. His knowledge and expertise in the area was everything I needed. And it is a great mentorship because I feel like it's a two-way street. Like, hey, I need a away rotation. I need a letter. All right, you can come here, rotate with me. Here's a letter. Hey, Anani, I need a med student to get on this bus with me and drive around the other undergrads and get people to get into medicine. Sure, I'll give you a week of my life. And it's just been like that back and forth. And it's been well. I've had mentors, in residency who didn't look like me, but those are just as important because if you want to operate in spaces where most people don't look like you, you should probably have the ear and the knowledge of someone who does not look like you. So I definitely recommend everyone to get a mentor who's going to help you get where you want to go. If they're green, yellow, blue, whatever. And it's great to have a black male mentor because they can help you get what you want to go and kick it after work a little bit easier. But just make sure you get someone in every phase that you need.
Now, just piggyback, it's hard to really follow up on them. I mean, you hit all the high points. I think it's also important to just kind of go through this knowing that while you're being mentored, you're trying to formulate your way of mentorship for others as well. Like, you always want to try to be the mentor that you wish you had at different stages. And oftentimes that comes with just, maintaining that sense of humility, and also understanding that, there's a saying out there, if you can't pay it back, pay it forward. I think Dr. Douglas had touched on this. You have to really think about the fact that for us to have more of us in these spaces, more of us need to get to these spaces and then reach back and pull people up. A lot of people get caught up in the life, whether it's, you know, the luxuries that come with it. They feel like they get too busy with, you know, life outside of the work because the work itself is busy enough, and then they fall into a silo once they make it and kind of close themselves off. When if somebody did that when they were trying to get there, they wouldn't have the mentorship they needed, right? So you got to always understand this work is so important, which is, you know, the reason for calls like this, like just reaching back to the people coming up at every stage so that they can see it, because representation is everything, but also the active mentorship and keeping the mindset that, you know, one day I need to, you know, pay my dues and mentor somebody else and help pull somebody else along. That's what's going to keep people going, you know, through the ranks and helping to increase the diversity in medicine, particularly Black men in medicine.
Yeah, I'm probably just going to reiterate. So I'll be brief, but maybe just share a little bit more personal touch to it. You know, I think tiered mentorship is what, you know, you've heard. And I think that, you know, as a medical student, I had, you know, as a first year medical student, I had a third or fourth year mentor in medical school. I had a resident that was a mentor, and then I had an attending that was a mentor, right? And so having different levels of mentors at different stages of their career is critical. And the same thing in residency. I have, you know, upper level chief residents that I consider mentors. I have junior faculty and senior faculty that I consider mentors. So having it at different stages, because they can, one, those who are closer to you can give you more relevant advice and mentorship than those who are further removed. But then also you have kind of like the trajectory of where you want to go, and you can interact and build relationships with people who are where you eventually want to be. When I was in med school, I had a mentor that didn't share the same ethnicity as me, and I had some that did. And I think that to both these brothers' points, that no matter what, having different mentors means that access to different resources and different wisdom that the other one might not have. I had a mentor that was great for research and just building my skills and my knowledge of how to do academic research, right? I had one that was like, just like more of a role model I could talk to about relationships in medical school or in medicine, being married as a physician, right? And then I had others that were like sponsors, like connecting me with people that I needed to know at different institutions so that I could land a residency job or a future faculty job. So I think, you know, mentorship is so critical. I mean, none of us are self-made, right? We all got here standing on the shoulders of somebody, and and I would presume that most of the, you know, of you listening today know that, because you wouldn't be here unless you recognize the importance of building relationships with people who have already done it.
Yeah, those are all very, very strong points and really are definitely important points that our audience can take away from. So the next question I want to ask is, how do you take care of yourself emotionally and mentally in environments where you might be the minority male?
I guess I gotta go first since we um I mean, so for me, this is being at U Chicago for surgical residency. This was honestly the first time I truly haven't been the only one, really. You know, we have a pretty diverse residency, especially for general surgery. A lot of African American residents, surgical residents at our program. So and that took a lot of intentionality and support from, you know, our faculty members to continue to recruit residents that reflect our patient population. But I would say, you know, in medical school and even undergrad, you know, I think I was very intentional about ensuring that I had a strong support network, whether it was my family back home or a solid group of fellas that were at my institution that I felt like resonated with the experiences that I had. And so, you know, I think certainly identifying people that you at your institution that you feel like you have shared experiences with and can bond in the trauma experience of going through medical school is critical. I think first and foremost, above anything I said, is for me has been my relationship with God and staying in tune with the Most High and still going to church, praying, and then also just finding outlets. For me in medical school, it was the gym. After class, I was in the gym lifting weights, doing some cardio, staying in shape. And that was a good outlet to just forget about school for a second or forget about what I saw in the hospital. And then, just again, just prayer and just having that strong support network, whether it's family, calling my mom on the way home from work when I had a rough day and just hearing her voice, those kind of things. So I think, coping skills is critical. And if you don't have any, you got to identify them now, because it certainly, there's a lot of pressures in life, especially as a Black male in this country.
Yeah, I'll follow that up and say, I think the journey throughout medicine, whether it's medical student, resident, fellow, attending, probably more so training, not so much attending, but it oftentimes will glorify, exhaustion. It will glorify the idea of, oh, I worked 90 hours this week. I worked 100 hours. My program, I go harder than y'all. Y'all not getting real training. And it rarely acknowledges the fact that emotional exhaustion is real and that you have to actually be able to sustain, and endure through the rest of your training to make it. And really, even again, beyond as an attending, to take care of patients, because you can't take care of others when you're not well yourself. So I think trying to kind of reframe that mindset and understand, kind of going back to that earlier talking point about vulnerability, understanding when you may be tired, when you may be on your last leg, running on fumes, and know when you need to take a step back. I have a mentee of mine, actually. He took time off of fellowship, took some leave of absence just to get himself together because he was exhausted. And that's totally fine. As long as you have support to do these things, speaking up and first voicing it is the first step. Just to make sure that you're not pushing yourself beyond a limit that's not sustainable and that could be detrimental to you, your future, and even, again, the patients that are under your care. I truthfully believe that while you push yourself and you isolate yourself at times through this, this process of becoming in medicine, it can be very, very burnout inducing, I'll say. But when you have connections outside of the hospital, maintain your connections, that's what also helps to build resilience. So I think the big part for me when I was going through my own personally was to make sure I maintained a connection with my friends, my family, faith. I was still trying to go to church every Sunday when I could. Residency was kind of crazy, working 6 days a week and a random day off on a Wednesday. So sometimes that wasn't possible, but still trying to maintain my own spirituality and just the things that were important to me, exercise, and then traveling. I think there was actually a point in my training where people thought I was unemployed because I was taking so many vacations. But I was like, I'm not about to sit here, get off of work, complain about work with my co-residents, to go back to work, to go do more work. I would just catch a flight and go, whether it was with friends, family, you name it. And that really helped me maintain my balance. Kind of on the other side, not to belabor the point, but, understanding that you're so busy with training and with the time commitments you don't have all the time in the world the way you used to. So that skill set of triage doesn't just apply to the patients you take care of. You got to triage your life and know where your priorities, align and with what's most important to you, and dedicate the time when you're not working to those things to kind of help refill your cup and keep you going. Whether it's the gym, whether it's music, whether it's art, whether it's just traveling, you name it, you got to maintain certain things to help keep yourself balanced, because medicine will tire you. It's inevitable.
I like all those things. When it comes to wellness, I like to say to one of the Dr. Chukwura's points that's hilarious. I was talking about this with my wife. I feel like I'm in the generation where 90 hours a week is crazy talk, but what you talking about? I need a sabbatical. Like I'm stuck in this I have to go to work, but do I have to work? I don't know. It's a weird age group now, but my wellness comes in small, medium, large doses, and then I have a continuous backup to make sure I'm okay. So I like to do small things in small doses. So, it's my office. I'm the medical director. I can get a little Yoda over there. That's fine, right? Yoda's chilling, making sure I'm doing everything wise and smart. I'm the medical director. I'm the attending on. I get to choose the music. Sorry, y'all. So, that's my Pandora thumbs up station. It's eclectic. As Stephen A. Smith says, it's fluid. You might get a little Hamilton on it. You might get a little flavor on it, but you're not going to get no curse words because I can't have the music playing and then something goes on and people looking at me like Dr. Nani was playing this in the doctor's area. So it's all chill, and I definitely turn the volume if some of the lyrics are too suggestive. That's my small stuff. I watch at least one YouTube video every day, like on video games or comic books or something like that. That's the small stuff. I have my medium doses where I call that my PlayStation time. I'm sitting down playing for an hour, 2 hours, not thinking about work, just locked in on what I like to do for fun, talking to friends, stuff like that. And then, of course, you have the large doses, catching flights, sections, whatever it takes to make myself happy. I am one of those people who I need dopamine to rush. I don't do it every Sunday. I don't do it every weekend. I don't do it every year. But if I want a dopamine rush, I want a dopamine rush. And I do a job that allows me to afford it. So those are like the things I like to do. Flights are way better than the sections, but if I want one, I'm going to get one because I need to sit down. And then I have the backup. So shout out, I'm going to double check it. We're saying it now to the Black EM chat group that is sitting at the group me 964 members right now. You can put whatever you want in that chat group. Bad day, good day. You won't believe what this GI doc said to me. Hey, how would y'all handle this, this AV block right here? Would y'all activate the cath lab for this EKG? And this group is awake 24/7. I have been on shift at 3 a.m. and sent something, and somebody somewhere is going to reply back, usually. Hopefully you get back on shift, sometimes you get back the next morning. And it's, other random stuff too, like, hey, y'all, so-and-so is going down this weekend, who's going to be there? But that group, I think, is an ultimate support to make sure, even when I feel alone in crazy spaces, I can pick up my phone and send something out and get a hand back. So those are the things I do.
Thank you. Thank you all for sharing. I definitely agree with it's important to doing what like filling your cup as much as you can. So for the next question, so within like the context of our overall topic, I want to ask, when it comes to selecting a residency or fellowship program or medical school to attend, what additional factors should prospective applicants be taking into consideration that you think isn't talked about enough?
It's a tough question. You don't want to state the obvious, right? But the obvious is important. You want to go somewhere where you're supported, like as a minority. I'll talk about my own personal experience. I know these brothers will probably share their own, but for me personally, I'm sure Dr. Anani can attest to this. Coming from Howard, it's an alternate universe. It is not the real world of medicine. I was in medical school for 4 years at that place. Look to my left, look to my right. I was surrounded by just a lot of melanin. And it felt so good. I got dopamine rush from just walking into the classroom, because, it was everybody that could relate to me. They had similar life experiences. We could talk, RN talk, and then we could talk, that medical talk. Like everything was just very, very fluid. Then I started applying to residency programs. I'm going to these interviews, at these big academic ivory tower institutions. I'm noticing I'm the only person of color in the interview room, the only person of color at most of these interviews. Looking around at the staff, the only person of color. Every now and then they would have like these URM recruitment dinners where they would basically invite the whole gamut of all the Black and brown and, Latino, Latinx applicants to come in, meet each other and kind of give, insight to the program from the one or two faculty they have that might be, considered minority. but that was not the majority at all. So I know for me personally, I was looking for a program that had a decent number of representatives of, you know, URM staff within the leadership. But then also looking at the trainees to see, were they actively looking to increase diversity in their classes? Because a lot of programs talk the talk, but they don't really walk the walk. They talk about these diversity recruitment efforts, but there's actually a lack of the actual the product of their efforts in their classes. So when I was interviewing at places, me potentially looking at where I could find a representation, I found 3 programs out of the 20 I interviewed at that really had the numbers, and it was very clear they were very active and diligent and intentional about recruitment, and not only recruitment, retention. Because it's one thing to recruit, you know, people of color to a program, but if you're not supporting them while they're there and they flounder and they drop out, they get kicked out, they don't do well, then it's like, what are you doing it for? Just for show? Or is it really because you actually want to help increase the number of Black and brown minority physicians in the workforce? So Duke really, really, you know, shined their light on that for me. And I went, and it did not fail to disappoint. You know, the efforts were very strong there, and I really helped along with other SNMA alumni. One thing you'll notice about this SNMA network, SNMA is a very powerful connection, very powerful tool, in that when you go to different places and you interview, if you find, you know, SNMA members at the institution, link up with them immediately, and it's an open book, open access to what the experience is really like there, and even, you know, potential advocacy and you know, pulling you in within the program. They can have a little ear in the program director's a little noise in the program director's ear to really advocate for you as a candidate, and that helped me a lot. I can't speak enough about the SNMA and how it helped me along my interview trail, and it really led to everything that came after that, because you start with the foundation of where you match residency, after that fellowship and attending. I mean, it's sequential. So if you start off strong, you'll end up finishing strong.
Yeah, I'm gonna just piggyback a little bit on that, especially for those who are thinking about applying to residency right now. I mean, this is such an interesting time to be talking about this, but I think tactfully, it's you need to ask, as Black men, what are these programs' commitment towards diversity, equity, and inclusion? And obviously, there's a way to go about asking that in a way that is respectful and is tactful. But it's an important question, right? Because we are seeing the rollback of DEI and commitment to hiring and training diverse residents. And so, you know, now more than ever, it's time. When I was interviewing, it was just after George Floyd and in the midst of the pandemic, right? And so there was this huge wave and energy in terms of establishing DEI committees in Department of Surgeries. And I remembered, and I took note of what programs had DEI programs before George Floyd and which ones created them right after George Floyd, and who was this really important to, and who was just doing it because it was popular at the time, right? And so it's you know, think strategically about what is the best way to ask that question as you interview with programs, to Dr. Marius's point, you know, find safe people people that can be safe spaces for you to ask those difficult questions. If you see, you know, a Black person on an interview at a place that you're interested in, you know, get their contact information, reach out to them, ask them about the program, and do they feel supported? Do they feel like they have mentorship? What is the atmosphere like as a person of color in that program? I think these are critical questions to ask, especially right now, to make sure that you end up in a space where you're not just tolerated but wanted, right? In terms of, you know, if for the students at the undergrad level, I would definitely ask, you know, as you are transitioning to medical school, you know, very similar questions as well. I would also look at the community that exists. I unfortunately didn't get to go to Howard. Would love to, but probably would have flunked out if I was there. um, but the programs like Howard, they breed. Well, they literally are the largest producers of Black doctors in our country, and so these are great places for undergrad students to apply to and to do your training at. But if you are at a PWI or interviewing and looking at PWI, certainly, looking at the faculty, looking at the makeup of the medical students, the residents, will start to give you a little bit of insight on what is this program's true commitment to training the next generation of Black men and women in medicine.
I agree with all of that. Shout out to whoever posted claims in the chat. I agree with you. Y'all can post more over there. We can read them. We will answer y'all questions and whatnot. But the numbers say that you are likely going to apply, and a lot of you will go to a program, residency or med school, that does not have someone that looks like you. So I used to always joke when I was reading personal statements and mentoring students, I'm like, dang, everyone Black can't work in Atlanta. Like, we got to go other places. So with that, I definitely say I would look at every specialty has a GME, I forget what they call them, like not acknowledgments or criteria that this program has to say you met to graduate in that specialty. And I would ask every program director, every program, what is your plan to get me and all of your residents from the start of this criteria to the end of this criteria? And I think in emergency medicine, you have to prove that you're proficient in these things. Every GME has a committee that reviews every survey on you, every consult, everything written down by you, every score, and what do they do with that? Some programs have internal remediation. What does that look like at your place? Some programs are, our name is too big to have remediation. If you are falling off, we cut you off. What is your recourse with that? And you just want to know what they do to get you through that. And if the program director kind of looks at that and says, well, are you trying to fail? It's like, no, but I want to know what you think failing is. And I think that's what's really important. When you know what they know what failing is, you change your whole thing around, right? Like, I know some specialties. We all have in-service exams. You're allowed to get whatever score you want in your first year. Then at that program in your second year, if you didn't get 70 above, they put you on remediation. And if you didn't get a certain score third year, they were holding you back. You didn't get that score again, they were kicking you out of the program. Mm-hmm. You want to know those types of things. So that is what's really, really important, in my opinion, when you're trying to figure out how to get through.
Okay, so we have a question in the chat. What made you keep going in medical school even when your back was against the wall?
So again, went to Howard. So back against the wall, my back was probably with some other people, or we were doing some other things on the wall. But it was really fun just to be in that environment. But I will use a real example of when my back was against the wall and I had to like pick myself up. I failed step one. I know nowadays step one to y'all is pass fail. So it didn't have that like boom that it had back in the day. But I failed it at Howard. And I remember just like being on that ground and so crazy. But I remember looking around and still knowing that people around wanted to lift me up. I was not left in the dirt and like, well, you failed, good luck and peace. It's like, no, friends, everyone, the whole class, what we gonna do to make sure love got through? What we gonna do to make sure that he passed? So having that encouragement and knowing that my colleagues did it and people I was studying with passed, I made sure to look at them and rely on them to study extra hard, take step one again and make sure to get through. And then after I did that, I know I can complete anything.
Yeah, I would just say for me, it was, I guess when my back was against the wall, I just had to really just remind myself that one, we didn't come this far to fail, right? That God didn't bring me this far to forsake me, and that I'm here for a reason, right? And you got to have this like unshakable belief that you belong in these rooms, right? And and it's not an arrogance or a cockiness. It's just the reality that you didn't get here by accident, And so, if you need affirmations, sometimes that's what it takes. Looking yourself in the mirror and say, I got what it takes. I can, I'm not here by accident. I'm meant to be in these rooms. I'm smart enough to be in these rooms. I have what it takes to excel in medical school. I think it's critical. I think talking to your mentors again, man. I mean, I remember in college when I did terrible in my intro bio course and I thought medical school wasn't for me and I needed to consider a different career pathway. And I called my mentor and I told him how it went. And he told me, give it one more semester, call me back and we'll go from there. And I did better. And, now I am where I am today. And so, when you are in those moments where you're like, you're back against the wall, you don't know what to do, call your mentor, call that person that you feel like is in your corner that wants to see you to succeed, and just be vulnerable and confide in them and let them know you're struggling, and reach out for help. That is critical. Reach out for help. If you are struggling, ask for help. Don't sit in silence and struggle, because there are people that don't want to see you fail. And if you want to fail by yourself, it will happen, right? So don't do it by yourself. Ask for help. And yeah.
I think those are all excellent points. I mean, I truthfully believe when you are facing adversity, it's almost like you're being taught how to develop discipline, but also surrender at the same time. Again, the vulnerability part, knowing when things are going bad, knowing when to ask for help. I don't want to repeat the same things that were said, but it's like you really can set yourself up for failure in a moment of what may be perceived as such just by not reaching out and asking for help. Uh, Personally, firsthand, Howard, there's a few students who we started med school with who didn't graduate. And mind you, they were quiet. They were in the corner. You wouldn't know if they were doing well or not, but it's just the next year they didn't come back. It wasn't until later we found out that they failed out. And that's something that's easily preventable if you reach out for help and you build a network, build the connection through the other students in the class, or through other means. Because even if you talk to mentors or some of your professors, they'll find a way to get you help. Like, nobody wants to see you fail. Nobody's going to turn their cold shoulder to you and say, figure it out. That's just not how it works. And if somebody does, the next person won't. Like, you really do have to stay isolated and not speak up to set yourself up to fail. It's hard to do it otherwise. And even if you're put in a situation where you feel like you don't have the support in one area, I'm more than certain you can find it elsewhere. I think it also goes to say that you can't be scared to be looked down upon. Going back to that point of humility, because at the end of the day, nobody's journey is easy. Whether or not they talk about it, whether or not they show it, everybody goes through hiccups. I know me personally, for me, I failed an exam. I think it was my first year, structure and function. Maybe it was like a neurology exam or something like that. I mean, neuro was hard as hell. There's no other way to say it. It's an anatomy lab till 3 a.m. some nights, dissecting that brain, and just kicked my ass on the exam. Part of my language. But when I failed, I thought to myself, like, wow, am I really cut out for this? Like, this is crazy. I've rarely failed. I don't think I ever failed anything before that in life. Very humbling. But I knew for a fact I was still rooted in my purpose. Like, I worked too hard to get to that point to stop at that point. And I wasn't taking that as a sign where I just was going to give up and quit. I went back and grinded and got it in. I started asking for help. Like, I had people in the class who did well, and I told them to please show me what they did, and came to them humbly, right? Was aware of my shortcoming in the matter and was humble enough to go ask for help. And that really made all the difference. So I think kind of also remaining rooted in why you started and having that intrinsic motivation. If you're motivated to go to medicine and get out because you want the nice cars or the money or the status, whatever people assume medicine comes with, half of that's not even true, right? It's a perception. But if you're pursuing it for that reason and you don't have a real rooted intrinsic reason, when you hit a roadblock or a road bump along the way, you're going to quit. You're going to stop because you're not doing it for the right reasons, for the intrinsic motivation. But when you maintain being rooted in your purpose and that humility to ask for help when you need it. Any roadblock that you have, which everybody inevitably has some hiccups, you will be able to get through it. I mean, that's that simple and plain.
Yeah, thank you guys for sharing your responses for that. Just to be mindful for everyone's time, I'll just ask like one like lasting question. Um, I just want to ask if, or just open up the opportunity for you guys to share any last pieces of advice or closing remarks to our next generation of Black male physicians.
There's so much I feel like I want to send out there or put out there, but I'm just gonna give one thing that may sound cliche and just stick with it. You are enough. You can do it. You can excel. Um, Dr. Chugura said that there's a lot of reasons a lot of people jump off this train or think they're not enough. I find it very ironic that I can find multiple Black small boys around the world who said they want to be in the NFL or NBA. That's like a 0.1% chance of ever making it there or something like that. When I tell them that a doctor makes six figures and does very well in life, and it's like, a 10 to 12%, they balk at it or say it's too hard. You can do it. You're enough. You can excel.
I would say, and it'll sound funny, but I can't miss this opportunity to talk to Black men about this. But clout is a powerful drug, and a lot of if I'm just keeping it a stack with everybody on the call, a lot of Black men in medicine kind of lose themselves in the clout that comes with being a physician in this space, and especially a Black man in this space. So just always remember who you was before this. Stay true to who you are. Don't let this get to your head, right? At the end of the day, we are here by, God's grace, and it wasn't because we were better than anybody else that came before us. We just, the circumstances aligned and we put in the work to get here. But just remember that, because you can easily find yourself in situations, if you let that clout get to your head, that could ruin your career or damage your reputation, right? And so, whether it's social media, whether it's in the hospital and interactions with other people in the hospital, just remember to stay true to who you are, and just don't let the attention and the focus of being, the unicorn in the hospital go to your head, because it can have devastating consequences.
Yeah, can't emphasize that enough. That was an excellent point. What they be doing now, they be doing this. That's what that deserves. I mean, because at the end of the day, all of this, you can lose it in a heartbeat. And you work so hard to get to this point, wherever you at, whether it's you're in medical school, you work very hard to get that seat, right? That seat in that class. Your residency, you work very hard to match. You're attending, you work very hard. Like, you just can't fumble this bag that they say is not really for us. You make up 2%, 2%. Like, you can't, don't mess it up. You gotta stay focused, stay grounded, stay humble. Like, show up every day and just be ready to learn. Be like a sponge, just soak up everything and be engaged, because you have to understand, even if you don't realize it, all eyes are on you. As Dr. Douglas said, you're walking through the hallways, people are looking like, who's this Black man in this white coat? Like, what? Like, people are looking at you, and when there's more eyes on you, there's more exposure, there's more risk that comes with that exposure to messing up, to having, the inherent mess ups that everybody else has, to having it actually recognized. And, you can make the same mistake. It happens. Like, it's happened to me firsthand. I'm sure it's happened to these brothers too. You can make the same mistake as your majority counterpart, but you get painted as the villain, the incompetent one, the one who, and they just, it kind of just gets brushed away. Or even if it's not, it's probably not even noticed. So you got to understand, you got to always show up clinically excellent. When your back's against the wall, that's when you're really going to find out what you're made of, who stands with you, how you, there's a saying that, two sayings. One is, you can bend but don't fold. Like, that's real. Understand you'll go through stuff, but it's how you bounce back, and not let these things break you. That's what's going to really define you. And then also, damn, I forgot the other one I wanted to say, but essentially just know that we have to work twice as hard to go half as far in a lot of these instances. And I don't want to offend anybody because I don't know who's on the call. I can't see no faces, but I'm going to use the term majority. Mediocrity is praised oftentimes, and sometimes we show up, excellent, and we don't get that same praise when we're doing more to a higher degree. But understand, you got to look in the mirror and be able to clap yourself, give yourself a round of applause, and pat yourself on the back, and understand you're doing this because you have put in so much work to get somewhere. And when you walk out from that stage where you're at before to the next stage, understand you're qualified to be there. You earned that. Don't let anybody tell you you don't belong. The only person that can tell you, you're done and that you can't do it anymore is you. You stop showing up. You stop showing up and doing your job. Like, it matters to be present, be excellent. Not perfect, but just progressing every day, trying to just put your best foot forward.
That's excellent closing points. Thank you so much. I want to thank all the panelists for taking the time this evening to share the valuable insight, the words of wisdom, and their encouragement as we all are progressing on this journey. And I know myself, and I'm sure everyone in the audience have been able to take away something very valuable from this discussion. So with that, I just want to say thank you so much for everybody for tuning in. And thank you once again to the panelists for taking the time to speak with us and share your words of wisdom. And I hope you guys have a great rest of the evening and a great rest of the week too.
Thanks for having us.
Thank you.
Yeah, thank you for having us.
Thank you. Mm-hmm.